Massachusetts-based Moderna is in its final stage of testing for the COVID-19 vaccine. But this week, a new study reveals more about the results of Moderna's first phase of its trial. 12 News reporter Alexandra Leslie has more details on this study's findings, plus reaction from one of the trial's volunteers.
The newly published results reveal more about the vaccine's immune response in older adults, and it also details how trial volunteers reacted to the vaccine. A study published in the New England Journal of Medicine this week explains results from a phase 1 extension of Moderna's COVID-19 vaccine candidate trial. The first phase of the trial tested people aged 18 to 55, but the extension tested 2 different strength doses in a group of 40 adults over the age of 55.
Just wanting to do my piece if something can come along.
Norman Helm is 65 years old and took the lower dose of the vaccine. He says he felt compelled to take part in the trial after watching first responders in New York and Washington State fight the virus.
Somebody had to do it, and I'm not making myself like a hero, but I mean, it's important to science that this data is captured.
That data shows older adults who got 2 injections of the higher dose 28 days apart showed an immune response roughly in line with those seen in younger adults. Authors of the study say the testing of the COVID-19 vaccine candidates in older populations, quote, is of paramount importance since these persons account for the majority of serious COVID-19 cases and associated deaths. As for side effects, Norman says he was fortunate not to have any.
People ask me about that all the time. Friends, yeah, how are you feeling? It's like it was like getting a flu shot, really. I mean, very non-event, sort of oriented.
2 older participants had severe reactions after getting the lower dose of the vaccine, but researchers say side effects in other participants were mild to moderate and resolved fairly quickly. I'm Alexandra Leslie, 12 News.